COVID-19 has had a major impact on all our lives and on healthcare across Europe and the rest of the world. And to discuss the impact of COVID-19 on transplant units and patients, we have prepared a few questions, and I go directly to the first one. How did COVID-19 impact your center? And we'll start with Anna Sureda, please.
We are an oncological center, so our general university hospital is across the highway. So basically, we were taking care exclusively of hematological patients that were infected. Basically, we organize our daily life to try to minimize the visits of the patients into the hospital, and of course, we adapted the type of treatment that we were giving to our patients, taking into consideration the pandemics.
We'll continue with José Moraleda, please.
Pandemic changed totally the disposition of our hospital, which is a university hospital of 1,000 beds. Everything was changed in order to minimize the contact between patients and health personnel, and the mentality of the health personnel also changed very much.
And then Christian Chabannon, please.
My institution is a comprehensive cancer center, so we treat exclusively cancer patients, including patients with hematological malignancies. We were thus not flooded with COVID-19 patients as happened in general hospitals. Nevertheless, and similar to what José just mentioned, we stringently reorganized our activities. The first one was to protect our patients, since there were from the very start reports that COVID-19 could be more severe in patients with neoplastic diseases. The second one was to protect our personnel, so we established some rotation. And finally, managing some of the scarce resource, especially at the start of the pandemics, protective equipment, individual protective equipment.
One of the most important questions early in the phase of the pandemic was whether or not we should change the indication for stem cell transplants. Did you change which patients underwent stem cell transplant at your center? And we'll start with Anna.
We changed following the EBMT board indications and other international bodies. So we significantly decreased the number of stem cell transplantations, and this decrease was basically seen in those patients potentially candidates for allogeneic stem cell transplant. We try to delay these procedures, giving the patients more cycles of chemotherapy or more cycles of checkpoint inhibitors.
Thank you. José?
We delayed, indeed, the non-urgent transplant, and we considered non-urgent transplant those with that have a low risk of relapse, particularly the multiple myeloma patients, and followed strictly the BMT guidelines about the.
And finally, Christian, and if you also could comment a little bit on CAR T cell therapy.
If we look at autologous transplants, similar to Hannah and José, at least originally, we moved the patients to a fully oral therapy. Allo transplant, we've tried to postpone the allo for those patients who could wait, but this represents only a small fraction of candidates to allo transplant. CAR T cells, these are also very unstable patients. They cannot wait for long. The supply chain was little disrupted, at least for the two commercial CAR T cells that we can access. And I was very surprised when we produced the monthly activity report at the end of July to see that actually in 2020 we did more transplants and we did more CAR T cells than in 2019.
The next question is, what are the most important lessons learned? And I can say from the Stockholm Swedish perspective is that I would have never envisaged that we could change our healthcare, particularly the access to ICU, the way we were able to.
From our point of view, the major lessons learned from this pandemic episode is, let's say, our surprising capacity to be able to quickly adapt to this completely new situation for us. And I think that we have also learned how to better use telemedicine. And I think that this is one thing that has been quickly implemented with this pandemic, and probably it's here to stay.
Thank you, Anna. José?
Yes, thank you. I think this is a very important question. Important lessons are, at least for Spanish people, is that we need to take care of our healthcare system. The healthcare system is been doing very well, but we need more investment. And also, I would say that we need more research in viral diseases and how to develop vaccines more quickly and manufacture these vaccines more quickly. Important is the social responsibility for the public health. And that's in my view, the general statements about the lessons of this pandemic.
Thank you. Very interesting. And Christian, from the French point of view?
Yeah, I think many things have already been said, but I'd like to stress again how agile the healthcare personnel and all the categories of healthcare personnel were to adapt to these new rules and environment, which in many ways is not very pleasant. Second point is I agree with Anna that telemedicine, we've heard of telemedicine for years and basically nothing happened. Within a few days, we were able to organize a vast majority of patients follow-up using telemedicine, whether video conferences or teleconferences. And finally, not only do we need to take care of the healthcare system, we need to take care of healthcare professionals. We need to maintain healthy personnel for them and also for the system to keep running.
Thank you very much, Christian. And as you commented, in all our three countries, in France, in Spain, and in Sweden, there are numbers that seems to be increasing. What are you doing now to prevent COVID-19 now when we are reaching into the fall of 2020?
I am usually quite an optimistic person, but I am a little bit pessimistic regarding this second wave coming in autumn. After having said that, I think that, and we have already discussed that in the prior questions, we have learned a lot of things. So I think that we have to basically streamline what we have learned from the first wave and trying to minimize as much as possible the number of infected patients in this potential second wave that I think that we are already seeing in some places.
Thank you, Anna. José?
We are doing PCR testing massively, although this doesn't decrease the number, the worried increasing number that we have in our country. We have changed the way we look after our patients with telemedicine mainly, and we, of course, need urgently a vaccine.
Thank you, José and Christian.
Again, very similar to Anna and José's description. We try to keep the virus at bay. All patients are tested before every admission. Actually, we've had a small number of clusters. Every time we could evidence that social distancing was not respected. So we try to educate people to strictly respect social distancing. The virus is there to stay for a while, at least for a significant period of time, and we have to adapt and learn how to live with it. And as always, education is key to protect people, protect our patients.
I can only echo what Christian just said. This is not a sprint race, this is a marathon. Hopefully we will have a vaccine that is able to moderate the disease and decrease the spread, but we will still have to deal with the virus for a long time to come. And with that, I close this session. Thank you very much again.
Thank you.
Thank you very much.